Chair, they didn't resend the agenda, Chair.
Honorable members, in the interest of time, I think I'm going to have to ask you to retrieve and back to your WhatsApps and try and retrieve that agenda so that committee coordinators and IT do not disrupt our meeting. But let's note this thing because we always raise it. We always raise it with committee coordinators and IT that you are going to have to talk amongst yourself and ensure that what needs to happen should happen. Every time before the meeting, I call committee coordinators. Is everything in order? And I was assured that things are fine. So we are honestly taking an exception about this thing, colleagues. And we'll raise it at an appropriate platform. Ndate Snokwan, please read the agenda for us.
Thank you, Honorable Chair.
Proceed, Ndate Snokwan, take us through the agenda, please.
Okay, Honorable Chair, I'm just
We've
looking
waited
for
about 15 minutes as it is on a procedural matter. It's really cannot be accepted.
Good morning, Honorable Chair. Good morning, honorable members. This is the agenda for the 24th June 2021. Proposed agenda: opening and welcome, attendance and apologies, adoption of the agenda, draft minutes of the previous meeting, matters arising from the previous minutes, and matters for discussion, consideration of the committee draft report, adjournment. Thank you, Chair.
Thank you very much. Honorable members, I hope that we were able to capture that. As we have indicated, it was also sent on the WhatsApp. I hope while it was read, you did make reference. Can I invite the reaction to the agenda?
Good morning, Chair. I've already raised the hand. I move for the adoption of the agenda. Thank you.
Morning, Chair. I second it.
Honorable Clinton. Proceed, Honorable Buti.
Oh, Chair, I've already moved for the adoption of the agenda, and Honorable Peter Way has already seconded.
Honorable Peter Way, let's hear you that you are seconding. Apology, I did not pick it up.
I'm seconding, Honorable Chair, and welcome to the new member of the portfolio on your lap.
Honorable Peter Way.
Thank you very much, honorable members, and for the understanding the disadvantages of working from home. There's no one with the indulgence of honorable members. Thank you. With the indulgence of honorable members, I think I've already done the opening and welcome. Explain a bit the nature and character of our meeting. Please take us through the apologies. I do not have any apology. If there's any, please indicate. before we proceed to the set of minutes?
We haven't received any apologies so far, Chairperson, not knowing whether Mr. Gangelizo did receive any. But from my side, I haven't received any.
Thank you very much. Honourable members, if you allow me, I think we can proceed. We are now at a point where we must take the two set of minutes. If you are allowing me, we can take them both and allow this Mukwani to take us through all those sets of minutes. Let's start first with the ones of the APP in that is Mukwani, and then proceed to the ones of the fourth quarter. Thank you.
Thank you once more, Honourable Chair and Honourable members. I'll start with the set minutes of the 8th of June, 2021 at 9. The chairperson, Honourable Timeko, declared the meeting officially open and welcomed all connected participants. Attendance, Honourable Meko, Honourable Khadebe, Honourable Smith, Honourable Peter Way, Honourable Nanyane, and Honourable Klute. Apology that was received was from Honourable El Mapena. And then the adoption of the agenda for the meeting was adopted. Minutes of the previous meeting were also adopted. Matters arising from the previous meeting, there was none. Matters for discussion. 6.1, consideration of annual performance plans for 2021-2022 financial year. The Department of Education, Health and Social Development presented their annual performance plans for 2021-2022 financial year and were adopted by the Portfolio Committee. During the discussion, the Portfolio Committee made the following resolutions. The Department of Education will be invited to brief the committee broadly on their challenges with SETA in relation to information and technology. The Department of Education to brief the Portfolio Committee regarding fee structure for subsidized learners and non-subsidized learners. The Department of Health must provide members of the committee with daily vaccination sites in order for members to inform communities. The Portfolio Committee on Education, Health and Social Services acknowledged presentation of annual performance plans of the following departments: Education, Health and Social Development. Point number 7, adjournment. The meeting adjourned at 13 hours, 7 minutes. Thank you, Honorable Chair.
Honourable members, those are the set of meeting during the meeting, our meeting where we're considering the annual performance plan of all the departments. Are the matters of correction as well as the adoption of the minute, and lastly, matters arising. If we could do them jointly. Any correction? Honourable Peter Way.
No correction, Honourable Chair, just matter arising.
Yes, proceed.
It was just agreed by the department and the MEC and the DDG that we will get the updated vaccination sites on a daily basis. And we have not been receiving this in spite of several requests from my side. I think the portfolio must now pronounce themselves on this, please.
Let's check other honourable members. Before we go into the discussions, we are going to have to adopt the minutes first, now that you raised the issue. If there's none from other honourable members, I think we can adopt the minutes and discuss the issue of the reports on the vaccination sites. Honorable members, can I invite your reaction on the adoption of the minutes? Mema Pena and Mena Nyani.
Thank you, Honorable Chair. I move for the adoption of the minutes. Thank you.
Mena Nyani.
I seconded the adoption of the minutes, Chairperson.
Thank you very much, honorable members. Let's reflect a bit on this matter. I'm not sure to what extent will we engage on it, because it is a resolution of committee, and I have seen the briefing on, not the briefing, a document on the vaccination side, where I think we need to be clarified. I hope committee coordinators will be able to do so. Is that how frequent can we get the vaccination briefing report? Will it be daily? Will it be weekly? What is the indication, I think, from the point of view of our minutes, our meeting, as well as the indication by the department? That Honorable Klute, let me give it to you before I give committee coordinators just to take us through.
Thank you.
A recap.
Thank you, Chair. Just quickly, as I remember, and I think Honourable Pituba will be able to give more assistance, but as I remember, the department itself said it was a daily, at that stage, daily information, and they actually said they'd be able to give it to us. So in my mind, it's not rocket science. We should just get it from them, and it should be distributed among the committee. It shouldn't be that hard to be able to get that. Thank you, Chair.
Thank you for that recap. You want to follow up, maybe?
Yes, Chair, I just want to, there is some confusion somewhere, because I've been corresponding with the Office of the Acting HOD this week, and every time I ask for this document, they either send me the surveillance, or then they tell me, no, they can't tell me how many people have been vaccinated. They don't seem to understand what they must send us. And the MEC made it very clear that every morning they have a meeting to establish the vaccination sites for the day. Now, I think it's not maybe possible, but I do know that at least every week they have a meeting and say, okay, on this week, or they'll be vaccinating at these institutions. Now, this is where we as the committee come in to assist the department, because I really get daily calls. I've had 3 this morning. Where can I go to be vaccinated? Then I have to say, I don't know. Because once I sent them to Boitumelo Hospital in Kroonstad, and they came back furious and said they're not vaccinating there today. So there is a vaccination schedule. I'm not interested in how many people were vaccinated, who were vaccinated, what the statistics of the vaccination is. That we get. We want to know, where can we tell the people to go to be vaccinated? The outcome of the vaccinations in the Free State is very poor. And one of the reasons is that the people don't know where to go to. They really, honestly, don't know where to go to. And this was explained thoroughly to the MEC, the HOD, and the DDG. And they agreed that this is vital information, and they will give it to us every day. I don't expect it every day, because I think they draw up a weekly program. So please, we as a committee must intervene and say, this decision was taken on this meeting. All 3 of them promised to do it, and it hasn't been forthcoming.
Thank you, Mepitaway, for that recap. Let's be guided by what the committee has resolved, as opposed to our individual expectations and individual interests. I like it when you say, this is what we have resolved. So the record will tell us that we are not going to await the recollection of the records. What we will do, honorable members, we will take decision out of the matters arising to say there's got to be a follow-up. Committee coordinators and our researcher have got to help us interface with the Department of Health. I will also do so at my level with the MEC and HOD to say the committee has requested that, one, you publicize sufficiently the vaccination side. You give us a report about those publications, including to give us that schedule as honorable members, because we've got our respective constituency offices, as well as by your own capacity. If you are able to do it every day, so be it. If you are able to do it weekly, so be it. Give us the statistics of the vaccinations of the people, including teachers, so that the committee, same way that we have consistently been receiving the daily briefings of the infection statistics, must also get the same around the whole program of vaccinations. We will impress on the leadership of the department. They did commit. I remember from the point of view of our meeting, the only thing that we must do is just a follow-up. I think that resolved the issue. If you allow me, honorable members, I will quickly move on. Ndate Nokwani, please take us through the second set of our minutes about the quarterly reports. Nokwani.
Thank you once more, Honorable Chair. This is a set of minutes of the virtual committee meeting held on the 10th June 2021 at 9. The chairperson, Honorable Timeko, declared the meeting officially open and welcome all attendees. Attendance, Honorable Meko, Honorable Mapena, Honorable Buti, Honorable Khadebe, Honorable H. Smith, Honorable L. Nanyani, and then Honorable Peter Way, Honorable Klute. And then apologies, none. Adoption of the agenda. The agenda for the meeting was adopted. Minutes of the previous meeting were adopted. Matters arising from the previous minutes, none. Matters for discussion, consideration of the fourth quarterly non-financial reports for 2020-2021 financial year of the following departments: Health, Social Development, and Education. 6.1, Department of Health. Monitoring and Evaluation Unit from the Office of the Premier briefed the committee on performance analysis of the Department of Health, Social Development, and Education. There was a mistake there. I will correct that, honorable members. And then going forward, oath was administered on Dr. M. Molokome as acting HOD, and then Mr. G. Mahlatsi as acting HOD. Mr. G. Mahlatsi had challenges with his gadget to connect to join the meeting. At the end of the presentation, the department committed itself to provide the committee with an updated agreement and the spreadsheet regarding the Lesotho debt. Department of Social Development. Oath was administered on Advocate Pasho and Mr. T. Ntsane. The department reported the following challenges to the committee. The department experiences serious challenges regarding the deviations as there is no physical contact due to COVID-19 restrictions. Community care workers, CCW, leave the department for greener pastures. COVID-19 has a negative impact on social services, as services of the department requires physical contact and group sessions. Department of Education. Oath was administered on HOD of Education, Mr. T. Malakwane. The committee took note that the department has achieved all its planned indicators for the fourth quarter. Total achievements translate to 100% for the fourth quarter. The committee commended the department on its performance. Adjournment. The meeting adjourned at 12:40. Thank you, Honorable Chair and Honorable Members.
Thank you very much, What did you say was corrected, Co-Department of Health?
No, I was saying that I might have missed something there, Chair. Department of Health and Social Development, or I repeated health instead of education. That is on 6.1. Department of Health. Monitoring and Evaluation Unit from the Office of the Premier briefed the committee on performance analysis of the Department of Health and Social Development and Health. So I should have said Department of Health, Social Development and Education. Chair, I'll correct it. Thank you, Chair. It's been noted.
Thank you. Honorable members, can we correct the minutes? No, don't remove the IT. Don't remove the minutes. Tabo. Thank you. I am noticing the hand of Honorable Klute.
No, Chair, sorry, that was an old hand, sorry.
All right. The correction that I want to make is on 6.1. The oath was administered on Dr. M. Molokome, not as acting HOD, as somebody who was presenting. The acting HOD is Ntate Mahlatsi. That sentence has got to be corrected. It is as if we are saying that Dr. Molokome is acting HOD. Unless if otherwise it's me who's not understanding it properly. But if honorable members are saying it's fine, I think it will still be fine. It will be okay. Because when I reread it again, there's also an element of it being correct.
On point,
yeah.
Chair.
Yeah, no, I don't think the challenge is fundamental. Honorable members, are the matters arising?
Not from my side, the Chair. And at the same time, I would suggest that we adopt the minutes.
Chair, Lucy Mapena here.
Honorable Khatebe is moving for the adoption.
Lucy
Honorable
Mapena.
Smith and Honorable Lucy.
Honorable Chair, I second the adoption of the minutes.
Thank you very much.
I'm
Minutes have
correct.
been adopted. Any matters arising? If there are no matters arising, honorable members, I think we're moving to the reports. IT, let's flight the report on the APP. That is, Nukwane will take us through the APP report. Thank you very much.
Thank you once more, Honorable Chair and Honorable Members. This is the report of the Portfolio Committee on Education, Health and Social Services to the Free State Legislature with regard to annual performance plans of the Departments of Education, Health and Social Development for 2021-2022 financial year. If you go to the first point, then point number 1 is the introduction. The Portfolio Committee on Education and Health and Social Service met the Departments of Education, Health and Social Development on the 8th of June 2021 to consider their annual performance plans for 2021-2022 financial year, as per the provisions of the standing rules and orders of the Free State Legislature. Okay, there is the members of the committee. And then we go to point number 3, procedure of the Portfolio Committee. The Portfolio Committee met with the Departments of Education, Health and Social Development on the 8th June 2021 to consider annual performance plans. The Monitoring and Evaluation Unit from the Office of the Premier provided analysis regarding the performance of the following departments: Education, Health and Social Development. Point number 4, consideration of the annual performance plans for 2021-2022 financial year. 4.1, consideration of the annual performance plan of the Department of Education for 2021-2022 financial year. Sorry. The department presented its annual performance plan for 2021-2022 financial year with the following programs. Below are the major programs of the department for 2021-2022 financial year. Program 1, Administration. Program 2, Public Ordinary School Education. Program 3, Independent School Subsidies. Program 4, Public Special Schools Education. Program 5, Early Childhood Development. Program 6, Infrastructure Development. Program 7, Examinations and Education-Related Services. During the presentation, the department outlined the non-financial performance plans of the department for 2021-2022 financial year and also targets set by the department for the current financial year. There are those program administration, and then we go straight to now to the observation, what do you call it? Program 7. And then we go straight to 4.2, consideration of the annual performance plan for the Department of Health. The department presented its annual performance plan for the 2021-22 financial year with the following programs. Below are the major programs of the department for 2021-22 financial year. Program 1, Administration. Program 2, District Health Services. Program 3, Emergency Medical Services. Program 4, Provincial Hospital Services. Program 5, Central Hospital Services. Program 6, Health Sciences and Training. Program 7, Healthcare Support Services. Program 8, Health Facilities Management. And then we now move on to outcome 3, morbidity and premature mortality due to non-communicable diseases. And then we go to outcome 4, quality of services in public health facilities improved. Okay, now we can just move straight to outcome 11, infrastructure maintained and backlog reduced. And then we go to, the committee was informed that annual performance plan outlines plans of the department for the upcoming financial year. This performance should, among other things, include performance targets and indicators to be achieved. The department, therefore, should be able to identify a core set of performance indicators needed to monitor performance, as well as linkage of annual performance plan, APP, with strategic performance plan, SPP. And then we now move on to point number 4.3, consideration of annual performance plan of the Department of Social Development for 2021-2022. The department presented its annual performance plan for the 2021-22 financial year with the following programs. Below are the major programs of the department for 2021-22 financial year. That is Program 1, Administration, Program 2, Social Welfare Services, Program 3, Children and Families, Program 4, Restorative Services, Program 5, Development and Research. And then we shall now shoot straight to observations and findings. That is point number 5. Observations and findings. The committee observed that, first, pertaining to Department of Education, the department plans in accordance to its targeted output. The department is still faced with challenge of SETA for procurement services. The department is not performing at the required pace to meet the demand of extra classes. In order to address the shortage of water at schools, the department is intending to drill boreholes. The department always brings substitute teachers where there is a vacancy or shortage of teachers. Migration of ECDs from Department of Social Development to Education will be implemented in 2022. The committee noted the contents of APP with its standardized output indicators, SOI, provincial output indicators, POI, and annual targets. Health. Targets set by the department are realistic and achievable. However, budget is not sufficient to cover all the costs. The department is concerned about the increase of new COVID-19 infection in the province. The committee noted the contents of the APP and annual targets for 2021-22 financial year. 3, social development. The committee noted the contents of the APP and annual targets for 2021-22 financial year, performance indicators, actual achievements, and annual targets. 6, recommendations. The committee noted the contents of the annual performance plans and the targets thereof. This will inform the basis for the oversight program of the committee for the ensuing 2021-22 financial year. The Portfolio Committee on Health and Social recommends that the report as tabled be adopted by the House. I thank you, Honorable Chair and Honorable Members.
Honorable members, that's the report. The recommendations are saying we must note the annual performance plan. It is just the department presenting it to us so that as we do oversight, we know what are we doing oversight on. Can we get reactions? Any indications, any adoption of the report? Honorable members, are you still here? Honorable Peterwee and Member Pena.
Yes, thank you, Chair. I'm just opening a document that yesterday I requested that we put in. I'm sorry, I'm just looking, and then the committee coordinator put the new document on the group where we include that under observations that we note that the department agreed to send, the Department of Health undertook to send the daily, weekly vaccination program schedule of the Free State on a daily, weekly basis to the Portfolio Committee. This was under observations and findings when I requested that this be added in, but I see it's not added in on this final report.
Now remember, annual performance plan is a plan. That matter belongs to the quarterly reports.
Okay.
During the meeting of the quarterly reports.
Okay, my apology.
Any adoption of the report? Are you moving?
I move.
Thank you very much. Any seconder?
I second, Chair. Thank you.
Thank you very much, Honorable Buti. Let's proceed, honorable members, to the last report of the fourth quarter of all the departments as discussed. Honorable Khatebe.
Yes, Chair. With your permission, can I be excused to assist the Speaker with the Youth Parliament Affairs?
Certainly.
Okay, thanks.
Certainly. Thank you very much. Let's proceed, honorable members. The most important thing in a report is observations and recommendations. What do we do when we go through a report of this nature? We indicate, honorable members, the headings. They've received this report. These are the reports of their own meetings. So let's not start it afresh. We can just indicate the headings and then go straight to observations as well as the recommendations. Thank you very much. Please take us through the fourth quarter report.
Thank you, Honorable Chair and Honorable Members. This is the report of the Portfolio Committee on Education, Health and Social Service, the Free State Legislature, with regard to the fourth quarterly non-financial report of the Departments of Education, Health and Social Development for 2020-2021 financial year. Yes. We shall move straight to point number 4, consideration of the fourth quarterly report. 4.1, fourth quarterly non-financial report of the Department of Education for 2020-2021 financial year. And then we go straight to the observations and findings. The department has submitted both their electronic and hard copies of their reports to the Monitoring and Evaluation Unit in the Office of the Premier on time. All planned indicators were achieved for the fourth quarter. Total achievement translates to 100% for the fourth quarter. We now move on to 4.2, which is quarterly non-financial report of the Department of Social Development for 2020-21 financial year. We move straight to the observation, if there are any. 4.2.1, observations or findings. The department did not submit their electronic and hard copies of their fourth quarterly reports to the Monitoring and Evaluation Unit in the Office of the Premier on time. In the fourth quarter, 62 indicators were planned for 2021 financial year. 37 of the planned indicators were achieved and 25 were not achieved. The department achieved an average of 58% and did not achieve 42% for the fourth quarter. Challenges as reported to the Portfolio Committee. That is 4.2.2. The department is experiencing a serious challenge with regard to deviations. Number of caregivers are leaving the department for greener pastures. COVID-19 has a negative impact on social services. I'll just have to add, if honorable members can note that the reason given by the department were that their performance is mainly based on physical contacts and group sessions. I'll just have to add that, but if you can remember, I've mentioned that in the set of minutes of the 10th. Thank you very much. And then I will now move to 4.3, fourth quarterly non-financial report of the Department of Health for 2020-21 financial year. That is, we'll move on to the observations and findings. The department has submitted both their electronic and hard copies of their fourth quarter reports for the Monitoring and Evaluation Unit in the Office of the Premier on time. Program 6, Health and Sciences and Training, only 25% of planned targets was achieved instead of 75%. Program 8, Health Facilities Management, 0 was achieved instead of 100% of planned targets. Point number 5, recommendation. The Portfolio Committee will make a recommendation. Thank you, Honorable Chair.
Thank you very much, Ntati Sunukwan. Other members, recommendations? Obviously, what Peter Way has raised around the